pharmacological information of the sildenafil. The mechanism of action of the sildenafil here, it inhibits the phosphodiesterase 5 enzyme, and this inhibition of the phosphodiesterase 5, you can also write PDE5 as a short form, increases the blood flow to penis. How? By increasing the cyclic guanosine monophosphate, cyclic GMP, and this cyclic GMP is responsible for the smooth muscle relaxation in the corpus cavernosum and allowing inflow of the blood that leads to the erection. So main mechanism here, if you see, there is two messengers, or one is enzyme and one is the mediator. The enzyme name is inhibition of the phosphodiesterase 5. If the drug inhibits the phosphodiesterase 5, that increases the cyclic guanosine monophosphate, cyclic GMP. And what is the role of cyclic GMP here? The most important role here is smooth muscle relaxation. And this smooth muscle relaxation leads to the erection of the penis. So you need to remember two terms here: inhibition of the phosphodiesterase 5 and increase in the cyclic guanosine monophosphate. What is the pharmacokinetic? Absorption. The sildenafil is available as a tablet form, and after oral administration, the bioavailability of drug is about 40%. Peak plasma time, the time that are required to maximum concentration of the drug in the blood, is near about 30 to 120 minutes, up to the 2 hours. And for the onset of action, start from after taking the tablet, the onset of action will start after 30 minutes. And another drug of sildenafil, it will start after 20 minutes. Metabolism. The sildenafil drug is metabolized by the liver cyclic P3A4 cytochrome P450 family, and amongst the P450 family, cyclic P3A4 and minor amount with the cyclic 2C9 is the enzymes for the metabolism. So here we need to remember the drug-drug interaction, if any. If the patient taking another drug that are also metabolized by the same enzyme, or the drugs inhibits the cyclic P3A4, we need to reduce the dose of the drug. We will see in the further explanation. So here you need to remember the drug-drug interactions if the patient taking another drug. Here also you need to remember if the patient taking the drug that increases the cyclic guanosine monophosphate. Example, generally the nitrates or nitroglycerin. These are the drugs, or we can say the vasodilator, generally used in the management of the blood pressure. These drug may increases the cyclic guanosine monophosphate. So we need to take care or precautious about the simultaneous administration of the sildenafil or nitrates. And here the drug-drug interaction. The elimination, the drug is eliminated or excreted by the feces 80% and the urine 13%. Half-life of the drug, the parent drug has the half-life near about 3 to 4 hours, and active metabolite has the half-life of 10 to 70 minutes. Dose and route of administration, generally 50 milligram oral tablet is available. 50 milligram oral 1 hour before the sexual activity is recommended, because the onset, just we seen the onset of action, it may take 30 minutes to 60 minutes. So that's why the 1 hour before sexual activity is recommended, and the dose may be increased to 100 milligram or reduced to 25 milligram. When we need 200 milligram, so it is that part of the drug-drug interaction. If the patient is not getting benefit from the 50 milligram, in this case only we need to increase the 100 milligram, or the patient has taking the medications and that medications inhibits the enzyme cytochrome P450 family. So we need to reduce the dose to 25, not 250, sorry, 25 milligram. Or in case of the patient has the kidney problem, it depends on the effectiveness, tolerance, and just a minute, and not to be exceed 100 milligram per day, because the drug has the adverse effect of hypotension and the shock. So we need not to be exceed more than 100 milligram per day. Yes, Father.